According to the American Lung Association, lung cancer is the second most commonly diagnosed cancer in both men and women. However, it is still the most common cause of cancer death. We spoke with Dr. Enrico Sobong at Desert Regional Medical Center in Palm Springs and asked him how lung cancer is diagnosed.
Ultimately, you're going to have diagnostic tests, which usually start with a chest X-ray. Most of the time nowadays, we do CAT scans and PET scans to help us define the extent of the tumor, and then ultimately we do a biopsy, and that's how we make the diagnosis.
Dr. Sobong tells us a little about screening for lung cancer.
Screening for lung cancer has been a major challenge to us, to everyone. And basically because until recently, there has been no clear strategy that would allow you to detect lung cancer at a stage where you can say you're more likely to cure that patient. In the past, we had done studies where we did serial chest X-rays on patients who we consider to be high risk, and of course those are the patients with a strong smoking history. Unfortunately, studies where we compared patients who got regular chest X-rays and those who did not, unless they had symptoms, those studies have not shown any difference in terms of outcome, that is survival. So those patients whose tumors were detected by chest X-rays did not necessarily live longer than those patients whose cancers were detected when they had symptoms. Recently, however, the National Cancer Institute sponsored the so-called National Lung Screening Trial. And what they found out was that they were in fact able to diagnose more lung cancers in those patients who underwent CAT scans serially for 3 years than those who just had chest X-rays when they had symptoms. More importantly, when they look at how many patients were cured of their lung cancer, there were indeed more patients who were cured when their cancers were discovered by CAT scans than they were when the patient just underwent no screening at all. So this is for the first time, this is the first study that has shown definite benefit of a screening method using CAT scan. CAT scans and MRIs are just special machines that are able to visualize lesions that are small, that are often missed by a chest X-ray. Unfortunately, the broad application of this method is still open to question. For one thing, it is very expensive. Smoking prevention is probably a much more cost-effective approach.